I first started noticing I was losing my hair when I hit 40. I tried different hairstyles, shampoos, lotions, even sprays that painted my scalp. But every time I looked in the mirror, I saw someone who looked a lot older than I felt.
I used to think about my hair, or my lack of hair, constantly. What if it was a windy day? Did I need to use more hairspray? I thought about hair transplants, but I just assumed they were too expensive, too inconvenient, and too painful.
You know, it's not just men who lose their hair. It happened to me, and it happened to my mother. I watched while she tried everything she could to hide that she was losing her hair. In the last 20 years of her life, I never saw her without a wig.
Most people routinely lose between 70 to 150 hairs from their scalp every day, primarily through washing, brushing, and combing. This may sound like a lot until you realize that the average human scalp has about 100,000 hairs. Generally, people only begin noticing the loss when about 40% of the hair density is gone. For some people, this thinning is just part of getting older and causes little or no concern. But for growing numbers of people, scientific advances in hair restoration alternatives have turned the impossible dream of once again having a full head of hair into remarkable reality. Dr. Robert Jones produced this video to answer the many questions you may have concerning hair loss and to inform you of the best solutions available. In this video, you'll learn what causes hair loss, how to assess your personal hair loss situation, and the current available solutions for hair replacement, including drug treatments, surgical hair restoration, and the state-of-the-art in hair transplantation, follicular unit extraction. And we'll address the most common concerns about hair transplants, including your questions about achieving a natural appearance, length of treatment, and possible discomfort. By the end of this video, you'll have an appreciation for the benefits of hair transplants, as well as an understanding of why surgical procedures such as follicular unit extraction have become the best solution for men and women who wish to maintain an active, healthy, and carefree lifestyle for years into the future. To understand if you might be experiencing hair loss associated with balding, it's first important to learn how hair grows on the scalp. Every hair grows within a hair follicle, which is a tiny tube of cells close to the surface of the skin. Within each hair follicle is a sebaceous gland that provides fat and grease to the hair, and an erector muscle, which lifts the hair off the surface of the skin at times of stress or to conserve warmth. We now know that hairs grow in groups of 1, 2, 3, and sometimes 4 that are called follicular units. It was only in the early 1980s that these groupings were recognized, leading to a revolution in the techniques of modern hair transplantation. The most common cause of hair loss in men and women is androgenetic alopecia. More commonly, this is known as male pattern baldness. Androgenetic describes a genetic predisposition to balding through the presence of androgens, or male hormones. All men and women produce these male hormones, the most common of which are testosterone and dihydrotestosterone, or DHT. It's the exposure of hair follicles to DHT over a period of time that leads to androgenetic alopecia. But there's good news. This genetic disposition to hair loss generally affects only certain parts of the scalp, typically the top of the head and the crown. This is why balding men usually have the horseshoe-shaped fringe of hair surrounding the bald area. These hairs in the fringe, and notably at the back of the head, are not genetically sensitive to DHT. The truth is, hopeful and desperate men have long fallen prey to hucksters and snake oil salesmen offering miraculous cures for balding. Even today, there are no cures for baldness. However, studies have found that in some instances, Rogaine and Propecia can halt or slow the progression of balding, although only on the crown of the head. Today, many hair transplant doctors believe that these drugs can help increase the rate of hair growth when used as a supplementary treatment for someone who has had hair transplantation. But these drugs in and of themselves are unable to restore a full head of hair.
For many of my patients undergoing hair transplants, I encourage them to get most of the hair in their anterior crown up to the hairline. They then can go on a regime of Rogaine and Propecia to thicken up their crown.
The best way to learn about follicular unit extraction is to hear from one of the leading experts in the field. Dr. Robert Jones studied at McMaster University's Department of Medicine, as well as both Harvard and Loyola Universities. A practicing physician since 1979, Dr. Jones and his staff now do microscopically prepared follicular unit hair transplants exclusively. Dr. Jones was the first doctor in North America to use the follicular unit extraction technique for the transplantation of individual hair follicles.
There's an art to hair transplantation when it comes to styling of the individual's look, according to what is natural for their overall appearance. Regrettably, a number of people offering hair transplantation fail at this, which means that the patient receives an unsatisfactory result. When performed by a skilled surgeon, follicular unit extraction can produce totally natural-looking hair transplants that can be completed in the fewest possible sessions. This means that even though it is slightly more expensive compared to lengthy, more time-consuming procedures, you'll heal faster and have less discomfort.
Dr. Jones is the leader in the practice of follicular unit extraction. Dr. Jones is one of the few physicians in the world who has perfected FUE transplantation to ensure that hair grows naturally in the right density and with little chance for complications.
Only follicular unit extraction allows for the smallest incisions possible, resulting in the best density of transplanted hair and also optimum coverage. Also, small incisions heal more quickly than larger ones, and scarring is less likely. And we've had tremendous success in relocating body hair from the chest and the back to increase scalp density.
Follicular unit strip harvesting is the process of removing a single strip of donor tissue. That ensures the naturally occurring follicular units can be preserved and damage to the individual follicles prevented. After a strip of hair is carefully removed from the donor site, typically in the back of the scalp, it is placed under a powerful microscope so these 1 to 3 hair grafts can be meticulously produced. The quality and size of these grafts are comparable to those produced through follicular unit extraction. Each incision is planned carefully to assure that the follicles are removed intact. Later, the hairs are dissected from the strip into 1, 2, and 3 hair follicular units. The smaller grafts are planted in the hairline and the larger ones further back to create density.
Through careful donor dissection and harvesting, it is possible to obtain 10 to 30% more hair from the donor area.
Dense packing of these carefully dissected follicular units is possible, requiring far fewer transplant sessions to achieve an elegant cosmetic effect.
When I made the appointment for my consultation, Dr. Jones spoke to me personally. There was no salesperson. I was very impressed with his knowledge and compassion and made a date for a procedure that same month. The surgery itself wasn't painful at all. In fact, I've had more trauma going to the dentist. The best part is it was a complete success and I couldn't be happier.
Of all the major factors that people consider when deciding to get a hair transplant, the cost is always high on the list. That's why we limit our overhead to save you money. Many other operations have salespeople and several doctors that come in on a part-time basis to perform your procedure. At my clinic, I'll be involved in every hair transplant, from beginning to end.
Fewer treatment sessions, minimal discomfort, and life-changing results. Follicular unit extraction truly has become the state-of-the-art for hair replacement.
My procedure was so undetectable that most people didn't even notice I had a hair transplant. They would just make comments like, you're looking a lot younger, or you look so much healthier. I guess the best thing I can say about my hair transplant is that I forget I even had it.
I think about my mother a lot and the pain she went through. I wish she could have had a hair transplant and know how great it is never to be embarrassed ever again about losing your hair.
It's been about a year since my hair transplant, and I just can't believe what I see in the mirror.
Please call Dr. Jones or visit the Hair Transplant Center website at torontohairdoctor.com.